Hello? It's your personal cranial nerve exam doctor, here to give you your examination. That's right, that's today. May I come in? Thank you. Good evening. My name is Zifi, and I am your personal cranial nerve exam therapist for today. I am here to make sure that everything is looking spick and span and at the convenience of you being in your own home. Isn't that so nice? So, I brought with me here I my super cool briefcase right here. As you can see, this is a very cool briefcase that has totally has a lot of things in it. I definitely. But before I get into all of that, let's first actually use the briefcase to do some very basic auditory testing. So I'm going to be tapping and maybe scratching a little bit across my briefcase here. I would like you to just listen and take note if there are any strange points where the sound seems to decrease at all or anything just seems a little off, just as a general diagnostic. Uh, uh, uh. I surprise myself every time I tap, I guess. Ah, ah, ah. Is that all sounding okay? Excellent. That's great to hear. Okay. I'm going to go ahead and put my suitcase down. Now, I'm going to be saying some words between your left and right ears randomly. I need you to tell me or just repeat the word when I say it. Okay? I'm going to get a little close. Okay? Sorry, I bumped into your face. Banana. Excellent. Postcard. Right? Bed sheet. Good. Lamp post. Good. Tequila. Getting some deja vu there? Television. Ooh, you thought I was going to say a whiskey, didn't you? All right. Seems like you got your bearings there. That's really good. That's really good. So it seems your left and right hearing for recognizing words and being able to repeat them, that skill seems pretty Gucci. But this is just the beginning. So let me rummage through my things here and pull out. Ah, here we go. I want you to say hi to Gary. This is Gary. Say hi. Uh, Gary here is going to kind of scan your face and your muscle structure on your face to make sure that all the nerves in your face, including like the cranial nerve and whatnot, are functioning properly. That there's proper blood flow to your mouth, your eyes, your nose. There are a lot of very important nerves there, and if anything's damaged, we need to know immediately. So Gary here is going to help me with that real quick. The wonders of technology, right? All right, Gary, do your thing. Just look straight into Gary's eye right here. job. Keep it up. Okay, the reading seems to be done. All right, pal. Gary, so how's it looking? Is our buddy here doing okay? Mm-hmm. Good. Great. That's excellent to hear. Are you sure about that? Uh, that's like very. I don't even know how you came to that conclusion just by scanning their face. Uh, Gary needs some time. But good news, Gary did say that all of your cranial nerves, your vessels, all the blood flow in your face is looking in tip-top shape. He just also added that you look gay as hell, which I really apologize. I swear Gary's not usually like that. I'll have to maybe update his OS. But that's all great. However, we need to make sure that everything is good in practice, right? Just because everything looks good physically doesn't mean that everything is functioning correctly in practice. So we're going to be doing a couple extra tests, okay? Now, I want you to relax, okay? Release any tension in all of your muscles. I'm going to do some facial scratching, okay? I'm going to scratch between kind of your cheeks upwards to your temples, all right? And I want you to just take it all in, you know? Pause, but, you know, let it happen. And if anything seems a little off, if one side is a little different from the other, please do let me know, okay? All right. You're doing a great job. I'm now going to focus on each side individually. Why am I crying? I'm a very expressive person, I guess. Good. Now this side. Back to this side. And back to this side. Excellent. Awesome. Good job. All right. Everything felt all right? Just felt the same on both sides, equally as awkward and strange? Excellent. Great to hear. Okay. Next up, I'm going to be holding up some beans up, and I need you to tell me how many I have sticking up. Okay? Good. Yeah. Good. Good. Is it 4 or 3 or 4? Yeah. Good. 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 Ooh. I pull that off with every single client. Every single client. All right. Sorry. I mean no offense. It's just a playful joke. Okay. Good. You can count. That I would expect that from someone of your age and the fact that you have your own house. You can probably count. All right. Moving on. Let's see. Let's see. Okay. I have, trust me, I have a tongue depressor. All right. And I'm going to press down on your tongue and I want you to say ah. You know, you've seen this a million times. I'm going to make sure that your throat is looking all good to go. Some ENT along with your cranial nerve exam, okay? So say ah. Let me look in there. Ah. Say ah. Ah. Keep going. Keep going. Got some mighty lungs on you. Ah. Okay, you can stop now. Mm. All right. Um, good throat. Looks great. Seen a lot of action, I can tell. So, must be quite the goat with your throat. I can tell. Um, you might want to cool off on that. Actually, it's looking a little worn in there. But you know, just saying. Take my advice or leave it. It's your call. But otherwise, your throat's looking great. That's good news. Take a look here. Ah, now I have here some pretty nice cream that is going to help with like reducing any sort of muscle tension that might be happening across your face. It's very easy for people to have a lot of tension, especially around the mouth, facial area, that they don't even know is happening. Don't mind that there's a little Among Us guy on here. I'm totally not recycling assets that I made. Um, Here. Let me give it a good shake first, though. You have to shake it properly, otherwise, it's not going to work well. Okay. Let me open this up. Get some of this on my hands. Really get that on there. On my paws. Okay. Alright. Now stay still. This is gonna feel a little slimy and weird, but knowing you, that's probably not that weird. It's just another Friday night, okay? almost done. I just need to get the sides of your cheeks here. Now, when I'm done, make sure not to wash your face for the next 12 hours so that the ointment can fully settle and do its magic, okay? And there we go. Great. You're looking awesome. Very shiny and glossy. Yeah, let me wipe my hands off real quick. My paws. The paw beans. The beans on my paws. Ooh. Well, now here's the question. These are technically paws, but my tootsies here are also paws. So how do I with my terminology differentiate between them? I'll have to consider that in a future video. Alrighty, so now that we have the ointment doing its thing, you're looking like you're doing pretty well. However, I do want to continue working on, or rather get started working on, your eyes. Let's make sure those eyes are working really well. You can focus properly. All right, so this is what I'm going to do. I'm going to wiggle my finger, paw, bean thing, right? And I want you to pay attention to it with your eyes. Focus on it. Don't move your head. Just move your eyes and focus on where I'm wiggling. So if I wiggle here, focus here. Wiggle over here, focus here. Okay? You're going to do great. Don't worry. All right. Good. 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 Excellent. Good. Keep going. Yeah, keep it there. Mm-hmm. Nice. Good job. Good. 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 All right. Excellent. Wow, you did really well on that. Okay. Now I'm going to focus in more on like some color stuff. Okay. Actually, I'm not going to do that because I don't think I have anything that really does color stuff. I'm not going to lie. My briefcase, um, in hindsight, I didn't really pack a lot of good things for ASMR and cranial nerve exams. Um, I had. I'll show you what I brought in my briefcase. I brought um, a M134 uh, because why not? You know, because sometimes things happen. Um, I brought. Let's see, my tech deck. Pretty cool. Ooh, 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 ooh. Pretty cool. Has Beanos on it. Um, I brought. Let's see. Oh yeah, I have this sword uh here. Um, because if somehow my M134 stops working, um, that would be bad, and I would then grab my sword and slice people. I play a lot of Devil May Cry. Let's see, and that's about it. Other than the totally not Among Us potion from earlier. So I am a little ill equipped, but already, based off of the exams that we've done so far, I can see that your cranial nerve is working just fine. All of your facial reactions, movements, it's all looking very normal, which is great. Except the throat thing, but that's not a life or death thing, so you're fine. Our cranial nerve exam is nearing its completion, but before I conclude it, I do want to do a smell test to make sure that your sniffer is sniffing properly. So here I do have some vials with some basic sniff testing equipment. So I'm going to pop these one at a time, and you just tell me what you smell. Okay? Pretty easy. Let's see. First one up. Take a sniff. What does it smell like? Coconut. That's right. Good job. Okay. All right. Next one up. Here, sniff. What does it smell like? Lavender. That's right. Good job. Good job. Okay. Next one up. Take a sniff. What does it smell like? Chocolate. Nice. Good job. Good job. Here's another one. Take a sniff. What does it smell like? Cool Ranch Doritos. That's right. Good job. Wow, you're really crushing this. All right, I need to get more obscure. Here, this one. I bet you're not going to get this one. All right, take a sniff. What does it smell like? Wow, you're exactly right. It's that's like very oddly specific. Yes, it's my friend's pet cat's dandruff, specifically from the sheets of his grandmother. Yeah, that that is exactly right. Wow. Okay, let's do one more. Okay, last one. There we go. Sniff. What does that smell like? It smells like me. Yes, right. Wow. Do you like it? No? I smell stinky. But, 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 I'm not stinky. I took a you're mean. But you know what? I can look over that. It's okay. Let me put these back. Because at the end of the day, I'm the one who's getting paid. Okay, well, that just about concludes our cranial nerve exam for tonight. Everything is looking in tip-top shape. Your sniffer is sniffing really, really, really well. Your eye coordination is looking great. And hopefully that balm, that lotion that I administered earlier, will help make sure that there are no weird muscle tensions that could be causing cramping or future issues. It should help you get full rest and relaxation, especially for tonight as the sun gets down and it's time for you to go to bed. So, thank you so much for hiring my services. I do, however, only accept either cash or check. So I am going to really quickly write down in my handy dandy book here the fact that you owe me. Well, let me see here. So if we calculated all the materials that we used, especially the sniffing equipment, because I was really expensive. Yeah, and then we add on the other stuff. Oh, plus it looks like Gary's a little damaged, so I gotta add that on because it's probably because of you for some reason. Insurance is gonna love this. And let's see. By the way, did you give me your insurance information? No, that's okay. We'll be doing this straight from your bank account. Okay, which are details that I do have. Let's see, because you filled it out on the website. Okay, plus how long do we? Basically 48 hours. Yep. Okay. And let's see. Yep. And an extra fee there because it's past my dinner time and I'm very hungry and you did not get me McDonald's when I arrived, so I need to go get food after. Let me do the calculations here. Okay, I think we have it. You owe me $5,683. That's just the base price. Plus everything else is actually $20,528.25. A whole quarter. So, I do expect that payment to be in by next week or in 5 to 7 business days. If it's not in, you will hear from my lawyer. His name is Zach Kraber. He will call you and will make sure that you get the legal action that you deserve if you do not pay this. But I am positive that you are a good citizen and you love the American healthcare system and you will pay all this. And you will do it by any means necessary because you have to. All right, well, that is everything. Thank you so much for having me here. It was a pleasure giving you your cranial nerve exam. I look forward to the next time in 365 days when I can bill you for another $20,000. Doodles.